In the last 2 years, hundreds of asylum seekers from Burkina Faso have trooped into Ghana's Upper East region due to frequent attacks on their communities by armed insurgent militant groups. The Boko West and Pusiga districts are the areas where most of these asylum seekers have sought shelter. At Tarikom, near Zebila in the Boko West district, hundreds of them are being sheltered in this refugee reception center set up by the United Nations High Commissioner for Refugees, UNHCR. The presence of these asylum seekers here also means that their children have had to be enrolled in school. At the Tarikom Primary School, 129 children of the asylum seekers have been enrolled from the kindergarten level up to basic 3. According to the headmistress of the school, Zinabu Alambila, this has shot up the school's total enrollment to 436 pupils, and with challenges such as lack of access to drinking water in the school, it has become a little more challenging to manage the children.
So the asylum seekers, first of all, came in through the UNHCR, Nabokado, and CRS. They came here and did some work for us by renovating our school, preparing our minds that they are to bring asylum seekers to come and join us. And for how they are faring, I can say that they are doing very well. They are coping. Most of them can write well. Most of them, though we have a challenge in communication because most of them speak Moshi, aside that, we are relating well with them.
Relief, Development and Advocacy NGO, World Vision Ghana, has constructed an 8-seater toilet facility for the Tarikom Primary School. The organization also donated some shoes of various sizes to be distributed to the school children.
So over the period, World Vision has been the lead partner for wash intervention in the schools and also at the reception center. In the schools, we have been responsible for the construction of 8-seater unit toilet facility for boys and girls. Today we came here to make some donations of shoes of various sizes to the children in this school because we also believe that this will go a very long way to support teaching and learning in the school.
Although the toilet facility provided by World Vision has been equipped with water reservoirs, there is no source of water supply except for any time it rains during the rainy season. The headmistress of the school, therefore, appealed for a mechanized borehole.
But now our greatest challenge is water. Our water is a little bit away from us. And so you have KG children going across the road, which is very dangerous just to drink water. So we are appealing to World Vision to support us get a mechanized borehole in our premises here so that it will take away that danger of the children crossing the road to drink water.
So that has been the work of World Vision. Let's get more on the scoop from Samuel Gbalu, Humanitarian and Emergency Affairs Manager with World Vision Ghana. Samuel, good morning.
2 years.
Okay, so Samuel, you would have to unmute so we can hear you.
Sorry. Good morning.
Very good morning to you, Samuel. Yeah. Thank you for joining the conversation. So I just wanted the scoop on what exactly World Vision has been up to. We've just showed the video to our viewers, but how did all of this start? And how did it culminate in what we're seeing now with all of these students in these schools?
Okay, thank you so much. Good morning to you once again and to our cherished listeners this morning. Yeah, just as the story highlighted, we had, due to the disturbances in Burkina Faso, we had the Burkina Bay people, moving to Ghana to seek for asylum. And so, as by international practice, UNHCR, who is a lead agency of the UN for refugees, mobilize them, and then open a camp in the Tarikom in the Upper East region. And as per international practice, World Vision was invited as a partner to work with UNHCR and then other partners on board. And for World Vision, our major area was supposed to be water, hygiene, and then sanitation. And so you realize that the toilet facility that has been provided to the school falls under that sector, that is water, hygiene, and sanitation sector. And so it became one of the assessments were done in the community to look at with the capacity of the existing facilities to see whether they will be able to accommodate the children, additional children that were needed in this school. And so what happened was when we look at the facility, you see that the school block was in a dilapidated condition. The toilet facility that was in that school was totally out of use. And then so what happened was the CRS came in to take over the renovation of the school. And then World Vision, working in the sanitation and hygiene area, took over the rehabilitation of the toilet facility. And that is how we came to where we are in terms of the toilet facility. There are other things that are being done in the health facility as well. World Vision is doing some renovation works as well in the Chips compound to also improve on the health facility for both the asylum seekers and then also the community people.
What has this immersion been like? Because, of course, they are Burkinabes, they've come into the country, they will have to integrate the children. What, from where you sit, has the integration been like since they've been in Ghana?
Yeah, it's not been easy. It's taken some time. It took us some time. They've been here for almost 2 years now. And then the camp has also been in existence since I think the beginning of towards the end of March, May, where the camp had been in existence. So there were discussions looking at how these children were actually going to be integrated. And as the teacher rightly said, language barrier was one. How do we get them to? Some of them are also of age. They've grown past certain levels of schooling. And so at a point, we have to just take those bold decisions with Ghana Education Service to see how they can be integrated. So actually, taking them on board hasn't been that easy. And I think that a lot will have to be done to really help them to be able to integrate properly in terms of the levels of education that they will have to go through. Because there will be a lot of things to be done, probably extra teaching probably have to be done in the camp and other areas to make sure that they are able to catch up with their Ghanaian counterparts.
So it's been some 2 years now. Obviously, not all of them came around the same or at the same time, but these are they would largely speak their local dialects and French. And so they would have had to integrate, into the Ghanaian system. But what would you say has been the level of urgency with which they have been treated? Because if it's 2 years down the road and we're still struggling with this, then where are the missing pieces that we need to bring to bear?
Yeah, I think the initial, what caused the initial delays was actually, like we said, they were coming in trickles. And, these were not adequate numbers to be able to, institute a response to quickly look at. So these were like, as it started, it was like some people coming in, going back. They were not actually staying in Ghana. They come in as and when there is a disturbance. Then sometimes 2 or 3 days they get back. So until a point where a number of them started housing themselves in the communities along the borders. And that was where government took a decision that, no, looking at the numbers now, it is important, in collaboration with the UNHCR, to quickly do some registration and move them to the camp setting. And as I said, you see that the camp setting started, the camp actually started somewhere in May. Immediately after that, one of the pragmatic steps that were taken was to quickly get them some space of learning. So they actually started learning at the camp. If you get to the camp there was some temporary structure that was constructed where they were given some being engaged so that they don't roam about, being engaged to take on some learning and prepare them to be able to integrate into the main school system. And don't forget, some of them also went through some trauma and all that. So all these things were done along to ensure that they are adequately stabilized to be ready for school. And I think that it hasn't been too late as such for me. I think it's still, all we need now is to make sure that more resources are provided to help them to adequately integrate into the system and move on with their learning.
In terms of impact, obviously, if they are here, it is because the circumstances on the other side would not have favored them. Of course, we know what has happened in Burkina Faso. But in terms of the impact, all of this, the humanitarian efforts and everything, have had on these people, what would you peg it at? How has this impacted their lives?
Very heavy and negative. It's not been easy. If you really see, most of them lost a lot of property. Just been there, and all of a sudden you have to migrate from your village, your community into another environment without knowing what is ahead of you. And even if you come to, see the tent, having to leave maybe a very comfortable house that you had, and to be under such conditions, I don't think it's something that somebody will take it lightly. That it's normal. It's not a normal situation. And apart from that, like I told you earlier on, some of them lost their loved ones. Some of them lost their husbands, especially men, to the attacks of these jihadists. And so, having lost your breadwinner and coming only with the children, even some children came with our parents. You see that this is, of course, very traumatizing. And to get over this, like I said, it requires a lot of efforts. But I think one of the things that we are seeing in them now is that life is beginning to return to normal and they are being housed. But I can say that the impact is quite heavy and really something that demands a lot of effort to get them back to their normal feet and to be able to integrate them well into the Ghanaian society.
In terms of government's work and all of this, what has it been like, the efforts as far as our government is concerned?
Good collaboration. I think that UNHCR is actually working in collaboration with the Ghana Refugee Board. And then in the Upper East region, presently where we are also working in collaboration with the local government stakeholders like the district, the municipal chief executive for Boku West. We also working with the regional minister. And then I think they are all very interested. In fact, there have been a number of times that the regional minister has paid visits to the camp to see their conditions of service, how they are living, and all other things that they think they can do to improve their stay, even including security. Adequate security is provided, and lighting and all that to ensure that at least they are more comfortable in where they live. So I think there's been a good collaboration from the side of government to make sure that these people are well treated and well received in our community.
Finally, Samuel, I'd like to find out, so we've made some gains. Of course, there have been some losses. What next? What is the way forward? What can we expect from World Vision as far as these brothers and sisters are concerned to make their lives even better?
Yeah, so for World Vision, we intend to, one, expand our partnership. We're currently collaborating with UNHCR and working on WASH. We're also collaborating with the World Food Program, also in providing cash assistance to some of the host communities, and which will soon be extended to the refugee households as well. So we are looking at extending our collaborations with other partners to ensure especially the well-being of the children, because our focus is more on children. And in your video, there was an issue, a desperate call for water being connected to the school. It's one of the things that we are looking at. There are a number of boreholes in the communities. One of the things that we are asking our technical team to do was to do an assessment on the yields of the boreholes. If they can be mechanized, then we mechanize them for the school and then also the health facility. If it cannot be done, then we also look at probably drilling a new borehole and then getting it mechanized for the school. And apart from that, we're also looking at, as I said, working with other partners and getting them very good teaching and learning materials. And just as we also supply them with the shoes and other things that they needed to make their stay comfortable. So we want to deepen our collaboration with both government and other UN partners to ensure that we give these refugees and their children a better living.
Thank you, Samuel, so much for joining the conversation. We're grateful for the how you've broadened the issues and shed light on the matters. Samuel Malu is a humanitarian and emergency affairs manager with World Vision Ghana. Thank you so much, sir. And that has been our conversation on that beat. We'll be bringing you a lot more coming up shortly on the AM show.